Hi everyone, my name is Katie, and today, along with my friends Sally and Julia, we're here to share some important information about a common eye issue called a stye, and how you can prevent or manage it with its commonly used medication. Have you ever woken up with a painful bump near your eye and wonder what it is? Well, you're not alone. Styes are more common than you might think, and in the next few minutes, we'll unravel the mysteries of stye from understanding what they are to how you can find relief. A stye, also known as a hordeolum, is a small painful bump that forms on or inside the eyelid. It's typically caused by a bacterial infection and can be quite uncomfortable. Imagine it as a pimple near your eye, but with more discomfort. It's essential to differentiate a stye from another eye issue known as a chalazion, which I'll elaborate on later, as it is less painful and tends to linger longer. Styes are quite common and can affect people of all ages. They usually happen when the tiny oil glands in your eyelids get clogged. In Malaysia, our warm and humid climate can make styes even more common because it leads to more sweating and increased oil production around the eyes. While styes are widespread, the exact number of cases is not known. However, certain things can increase your chances of getting a stye. For example, if you've had a stye before, you're more likely to get another one in the future. Also, people with conditions like diabetes or high cholesterol levels, or those who use old makeup and don't regularly remove eye makeup, have a higher risk. Now, let's dig into what's happening when a stye forms. The infection begins when bacteria, particularly Staphylococcus aureus, enter the oil glands of your eyelid. This invasion triggers inflammation, making your eyelid red, swollen, and painful. To simplify it further, think of your eyelid having 3 different glands involved in stye formation when they get infected by this bacteria. First, there are the Zeiss and mole glands, which are found at the base of your eyelashes. When these glands become infected, you'll notice a painful swelling and a localized pimple-like bump on your eyelid, which is what we often call an external stye. Then there are the meibomian glands located inside your eyelid, which produce an oily layer that keeps your eyes lubricated. If one of these gets infected, it causes an internal stye. This one is a bit trickier to spot because it's deeper inside your eyelid and doesn't have a well-defined appearance like an external stye. Lastly, there's a condition called a chalazion, which isn't caused by infection, but rather by a blockage in one of the meibomian glands. It tends to be less painful and shows up as a painless lump in or on your eyelid.
To diagnose if what you have is really a stye, only a physical examination is needed whereby the doctor or pharmacist asks about your symptoms, medical history, and examines your eye. Diagnostic tests are not required as they might not be useful during diagnosis. In certain cases where the stye affects your vision or is worsening, it is recommended to visit the doctor for further evaluation as it may be another more severe underlying eye infection. Although styes usually resolve within 1 to 2 weeks, you can speed up the healing process and prevent secondary infections by visiting your local pharmacy. Upon inspection, your pharmacist will usually prescribe chloracine eye ointment whereby it is applied on the affected area 3 times a day. Its active ingredient is chloramphenicol, a broad-spectrum antibiotic which is commonly used to treat or manage superficial eye infections. It works by inhibiting protein formation of bacteria which cause the stye, hence preventing the bacteria from growing. For styes that are persistent, doctors may recommend treatment options such as antibiotics or surgery. Antibiotic eye drops or topical antibiotic cream are prescribed by the doctor for such cases. However, if the infection persists or spreads beyond your eyelids, tablet antibiotics may be recommended. Surgery is another treatment where the doctor will make a small cut in the stye to drain the pus out. If you suspect you have stye growing on your eyelids yet prefer to treat it at home without medication, here are a few ways to ease the pain and irritation. Use warm compresses. Apply a warm damp cloth to your eyelid for 10 to 15 minutes 3 to 5 times a day. Soak the cloth in warm water to rewarm it, wring it out and repeat. As green tea has antibacterial properties, some people do use moistened green tea bags as compressors to help the stye feel and heal better. However, you'll have to ensure no tea leaves or powder gets trapped under your eyelids. Clean your eyelids. Gently clean away any eye discharge using a mild mixture of half baby shampoo and half water. Special eyelid wipes can be found at pharmacies and can be used to clean the eye discharge. Painkillers such as Panadol can be taken to temporarily relieve the pain and reduce inflammation. Here are some other steps to avoid until the stye has fully healed. Popping the stye yourself, wearing eye cosmetics or other facial masks, wearing contact lenses, rubbing the affected area continuously. Although styes are usually harmless and resolve on their own with proper care, if you experience severe pain which persists, vision changes, enlarged stye, or inflammation that begins to spread, it is crucial to seek professional medical advice.
As certain cosmetic and hygiene practices may increase the chances of you getting a stye, here are some tips to prevent them. Firstly, wash or sanitize your hands before handling eye products such as contact lenses, eye drops, or other eye cosmetics. Next, avoid expired cosmetics and always remove your makeup thoroughly before bed. If possible, try not to rub your eyes whenever they are itchy or feel uncomfortable. Lastly, avoid sharing personal items in contact with your eyes such as face towels or eye brushes with others. Although styes are not considered contagious, bacteria can still spread from person to person through direct contact, either from your hands or from contaminated products such as eye brushes and towels. So, with proper eye hygiene and preventive measures as mentioned previously, you can decrease your risk of stye formation. Now that you've learned all about styes, here are some questions to test your understanding. Question 1. What is the main cause of stye development? Is it A. Bacterial infection in the oil glands of the eyelids, B. Staring at a digital device for too long, C. Wearing makeup, or D. Swimming? The correct answer is A. Bacterial infection in the oil glands of the eyelids. Various activities or practices such as wearing makeup or swimming can cause styes as bacteria gets trapped and accumulates in the eye glands, thus triggering inflammation which results in swelling, pain, and itch. Question 2. What can you do to prevent or reduce the risk of developing a stye? A. Clean your hands thoroughly before putting on contact lenses. B. Ensure all makeup and cosmetic brushes are clean to use. C. Avoid rubbing your eyes. Or D. All of the above. The correct answer is D. All of the above. Although you can't completely prevent styes from forming, these practices can significantly reduce your chances of developing a stye. This is the last question. What is the best way to treat a stye? A. Using chloroxine ointment prescribed from a pharmacist. B. Popping the stye. C. Applying ice on the stye. Or D. Washing the stye with mild alcohol. The correct answer is A. Using chloroxine ointment prescribed from a pharmacist. Never pop, squeeze, and scratch the stye with your hands or rub with household chemicals as it can lead to secondary infections. Remember, always seek professional help if you're unsure. To sum it up, styes are a common and minor eye infection that can affect anyone. It is caused by bacterial infections in the oil glands under the eyelids. Luckily, most cases of stye can resolve itself within 1 to 2 weeks. However, more severe and persistent styes can be easily treated at home or by medication, usually chloroxine ointment prescribed by a pharmacist. Although styes are not a serious condition, it is always better to prevent than to treat. So, remember to practice proper eye hygiene, especially if you have a history of styes, and use makeup or contact lenses frequently. And that's all from us on treating, managing, and preventing styes. If you would like to learn more about styes, do check out our Instagram page by scanning this QR code.